Absolutely, Ramon. Here's a set of 5 UMLE-style high-yield questions focused on the pyruvate dehydrogenase complex, PDC, integrating biochemistry, clinical concepts, and cofactor memorization using your preferred symbolic style. Equals leads to, decreases, equals increases, with full verbal explanation when presented. Question 1. Cofactors of pyruvate dehydrogenase. Which of the following sets of vitamins is most essential for the proper functioning of the pyruvate dehydrogenase complex? A. B1, B2, 3, B5 lipoic acid. B, B1, B6, B9, B12 vitamin C. C, B2, B6, B12 vitamin D, vitamin E. B1, B3 biotin folate, vitamin A. E, B2 niacin, vitamin K, B12 vitamin C. Correct answer, A. B2, B3, B5 lipoic acid. Explanation. Pyruvate dehydrogenase complex requires 5 key cofactors: thiamine B1, riboflavin, B2 as FA, niacin, B3 as NADME, pantothenic acid, B5 as CoA, and lipoic acid. Mnemonic, the lovely coenzymes for nerds. These are essential for converting pyruvate acetyl-CoA, which links glycolysis to the TCA cycle. Question 2. Arsenic poisoning mechanism. A patient presents with vomiting, garlic breath, and skin pigmentation. Labs reveal QT prolongation. Which of the following is the most likely mechanism of toxicity? A. Inhibition of A-ketoglutarate. B. Activation of succinyl-CoA, inhibition of lipoic acid. D. Blockage of thiamine pyrophosphate. E. Impaired glucose absorption. Correct answer C. Inhibition of lipoic acid. Explanation. Arsenic binds and inhibits lipoic acid, which is a required cofactor in both the pyruvate dehydrogenase complex and off-ketoglutarate dehydrogenase complex, leads to ATP production, leads to multisystem failure symptoms, vomiting, diarrhea, garlic breath, skin changes, and QT prolongation. Question 3. Metabolic state regulation. Which of the following metabolic states and signals would most likely activate pyruvate dehydrogenase in hepatocytes? A. High NAD and NADMIC ratio and high ATP-B. Low C-ACMIs and low ADP. C. High NADH ratio and C-ACMI. D. Fasting with high glucagon levels. E. Acidosis and increased fatty acid oxidation. Correct answer C. High NAD and NADH ratio and increased calcium. Explanation. PDC is activated by NAD-NADH ratio, leads to more substrate availability. ADP and cobalt signal energy demand, activating the complex, leads to conversion of pyruvate acetyl-CoA, feeds into the TCA cycle for ATP production. Other choices involve inhibitory signals like high NADH, high ATP, or fasting state, which downregulate PDC. Question 4. Similar enzyme complex in TCA cycle. Which of the following enzymes in the TCA cycle uses the same 5 cofactors as the pyruvate dehydrogenase complex? A. Isocitrate dehydrogenase. B. A-ketoglutarate dehydrogenase. C. Succinyl-CoA synthetase. D. Citrate synthase. E. Malate dehydrogenase. Correct answer, B. A-ketoglutarate dehydrogenase. Explanation. Both PDC and A-ketoglutarate dehydrogenase require the same 5 cofactors: thiamine and B1, lipoic acid, B5, FA, B2, NAD3. Both catalyze oxidative decarboxylation reactions, producing NADH and a CoA-linked product, acetyl-CoA or succinyl-CoA. Question 5. Pyruvate dehydrogenase deficiency. A 6-month-old boy presents with developmental delay, lactic acidosis, and neurologic deficits. He is placed on a ketogenic diet. What is the most likely enzyme deficiency? A. Pyruvate carboxylase. B. Glucose 6-phosphatase. C. Pyruvate dehydrogenase complex. D. Lactate dehydrogenase. E. A-ketoglutarate dehydrogenase. Correct answer C. Pyruvate dehydrogenase complex. Explanation. PDC deficiency leads to accumulation of pyruvate, gets shunted to lactate via LDH and alanine, results in lactic acidosis and neurosymptoms. Ketogenic diet is used to bypass glycolysis by supplying energy via fatty acid oxidation and ketone bodies. Let me know if